Hello, I am Serdar, co-founder of Albert Health. Albert Health is co-founded by three former Siemens employees in 2018 in UK. We built a voice assistant before in Siemens, then we left the company and started our own journey. We joined the Paris program of Global Startup Accelerator Techstars and raised 320k seed round so far. And we are selected by Forbes to 30 under 30 list in Turkey. And as a good news, we are accepted into Health Hub 2020 program in London last month. It's a program organized by Novartis and Telefonica, and it includes the $85,000 investment and POC with NHS. We will co-develop a product with Novartis to solve post-COVID problems of NHS. What is the problem we are solving? It's a medication adherence. 50% of people with chronic diseases do not take medications as prescribed, and the elderly people suffer the most. Solutions exist in the market, but elderly people are not using these apps. These apps are complicated with too many buttons, which they don't understand, or too much text, which they can't read. But the voice technology is the answer. Voice is the future, the natural interface for every human. Albert is a voice-based health assistant. Our users are just talking, and they can check their symptoms. They can check they can set up pill reminders. They can manage their medications in easy and effortless way. And if they need, they can have a virtual online video calls with doctors. Albert is also a bridge between the caregiver, doctor, and the patient. The caregiver will take the reminders and reports about the patient's medication. Some example screens, the daily schedule of the patient, the voice command chat for the recording health measurements, hand washing reminders for the coronavirus, and listing the doctors and the video call in the app. Doctors also has a web dashboard. They can see monitor the patient's data, and they can send messages, reminders, and advices to the patient. We have two business models. First, the premium model, but more important one, our focus is on B2B2C side, the special programs. We are creating special programs with pharmaceuticals, hospitals, and insurers. And we are charging them based on registered users. For insurers, we are doing preventive care programs, tracking programs, and the telehealth projects. There are 40 million people just in Europe who do not take the right dose at the right time. To address this problem, European health industry is spending 125 billion euros. Just global medication adherence market is projected to reach 3 billion euros in this year. And we have a good traction. We have reached the 17,000 registered users in Turkey. And we have very good commercial agreement with the Compu Group Medical in insurance, in Bayer, Novartis, IQVIA in pharmaceuticals, Acıbadem in private hospitals, and the Siemens, the corporate. And we can also design a special program with NN. The NN customers will just talk to Albert, and they can check their symptoms. They can manage their diseases, their medications. And if they need, they can have a virtual doctor visit with our mobile app, and they can take healthy living tips and the preventive advices during the day. And all these features will just with voice command. Of course, it will create a great value, the data analytics for customer base, differentiation in highly competitive market, and cost reduction in long term. Thank you for listening. Looking forward to working with you.